Welcome back. Well, today I have Dr. Michael Davinci, who is here on behalf of MemorialCare Saddleback Medical Center. Welcome, Dr. Davinci. How are you?
I'm doing well, thank you. How are you?
Good. I'm so glad you could join us today, and I know this is your first time with us, so I'm really happy to meet you. We see lots of different doctors from all different areas from Saddleback MemorialCare, as you know, because it's just a giant hospital and giant services over there. So before we get into your specifics, you're a urologic surgeon. Let's find out a little bit about you. How long have you been here?
So I've only been here since August of last year. I moved down here after finishing fellowship up at USC in downtown LA.
Okay.
But I love it down here. You know, I have 2 dogs, and I live in the community. I live in Laguna Hills.
Okay.
And so I work here, and I really like it down here.
You were on the East Coast for your entire life?
So yeah, I grew up in New Jersey. I went to college out there. I went to medical school out there, and then after medical school, I moved to St. Louis, Missouri for residency at Washington University in St. Louis.
Okay.
And then came out to LA to do a robotic surgery fellowship.
Oh, okay. So when and we'll get into robotics later because that's part of the treatments that you have. So why did you become this kind of surgeon?
So I think I always knew I wanted to become a doctor, become a surgeon. My father's a surgical oncologist.
Okay.
So I grew up going on rounds with him in the hospital on the weekends, and my uncles are surgeons. My whole family actually ended up all in medicine.
Okay.
I'm the oldest of 4, and I have 3 younger siblings. 2 are doctors and 1 became a physician assistant. So I think medicine is something that just came natural to me.
Okay.
My mother's a nurse, you know, so everybody kind of gravitated towards the medical field.
Yeah.
And then when I was in medical school, I got exposed to urologic surgery. I actually decided to do a year of research, primarily focused on kidney cancer at Memorial Sloan Kettering Cancer Center in New York City during the middle of my during the middle of my medical school. And I just really enjoyed the field. I liked the opportunity to work very closely with patients, to really kind of see them throughout their life and really continue their care, to get to do smaller procedures in the office, and then also get to do, you know, bigger procedures and really, you know, have a big impact on people and really help people, which I think is really, you know, very humbling.
Well, some of the treatments for prostate cancer in particular have really advanced.
Yeah.
And you had mentioned robotics, and I know that that's part of some of the treatment options that you can do. Tell me a little bit about what exactly a urologic surgeon is. Are you primarily handling prostate cancer patients?
So actually, urology is a pretty big specialty. We cover a broad range of diseases, from, you know, kidney stones to urinary tract infections to enlargement of the prostate, whether it's benign enlargement of the prostate or prostate cancer, erectile dysfunction, kidney masses, bladder cancers, testicular cancer. So it actually is a pretty broad range of different things that we see on a regular basis.
Oh, okay. So it's not just prostate cancer. Let's talk a little bit about some of the screenings, which is primarily for prostate cancer, because some of the other ones, I mean, you can't test for kidney stones.
Yeah, I mean, so if we see blood in somebody's urine, that can alert us to potentially a kidney stone or a bladder mass or something like that. So usually a patient's primary doctor would test their urine and see, and if they see blood in the urine, or if somebody sees blood in their urine, then they come to see us in our office, and we kind of work up and see what could be the cause of the blood in the urine. But primarily, screening is focused on prostate cancer.
Right, okay.
And so for men who are over 55 up till about 70, they recommend, you know, yearly PSA screening. We do rectal exams. And for men over 70, you know, if they still have a greater than 10-year life expectancy, if they're otherwise healthy, then we'll continue on screening. For men who have strong family histories of prostate cancer, African American men, people that are just higher risk for prostate cancer, will even do screening sometimes, you know, under the age of 55. But primarily, you know, 55 to 70 is where the most of the people that are diagnosed with prostate cancer fall in.
And then let's talk about some of the surgical options. Now, you have some lesser invasive options. What are those?
So Primarily, the surgical treatment for prostate cancer is a prostatectomy, meaning removal of the entire prostate. So initially, they used to do this all open, and now most of them are done actually robotically or minimally invasively, where we make a number of small incisions in somebody's belly, and then one larger incision where the prostate comes out through. And we're able to do this in a way where people have less blood loss, less pain. They're able to go home the next day, and we're able to do more nerve sparing where we can help to preserve erectile function. They have quicker return of continence, things like that, which really can be a big change in the way that people, their lifestyle after the surgery, and they can go back to a normal life.
Yeah, that's great. Good news. And then what about some other options? There are is it called Davinci robot, and that assists you in this particular type of performance?
Yeah, so this assists me when I'm doing prostate surgery. So it basically allows us to have wrists on our instruments so that we can do much finer movements, things that we in the past only were able to do open. Now we can do through a number of small incisions, and we're sitting at a console basically doing the surgery. And this helps me with prostate cancer surgery. It helps me with kidney cancer surgery. I can do, I can remove just part of somebody's kidney with a mass as opposed to having to take out the whole kidney, so that you can leave a lot of kidney tissue behind. And so people that have kidney disease, things like that, they can preserve a good portion of their kidney even if we have to take out a part for a kidney mass that we think is a kidney cancer.
Okay. Now you mentioned for prostate using robotics, it's like a better recovery. Is that also for the other cancers as well?
Yeah, so a lot of urologic surgery has a transition to a more minimally invasive approach, which has smaller incisions, less pain, less bleeding, quicker return. We have very good visualization, and for prostate cancer in specific, we're able to do a very good nerve sparing. And for a lot of guys, who had a lot of erection issues after surgery in the past, now we're able to do better nerve sparing and really preserve erectile function and preserve continence, which is huge for their quality of life.
Exactly. All right, some other interesting technology. Blue light technology. How is this being used for bladder cancer?
So this is something that Saddleback Hospital recently acquired, and for bladder cancer, sometimes it can be very hard to see small bladder tumors when we're looking in the bladder through cystoscopy, which is a camera through the urethra tube. And blue light really helps us. What happens is the patient comes into surgery. In the preoperative area, a catheter is put in, and Cysview, which is an agent, gets instilled into their bladder about an hour before the surgery. And then when we look in with a special light, a blue light, we're able to actually see small bladder tumors that we can't see with the naked eye.
Oh, wow.
And so that helps to prevent these tumors from becoming bigger, and helps to decrease the recurrence of bladder tumors, because things that we wouldn't have been able to see before, now we can see, we can take care of before it becomes something bigger that we would have been able to see with the naked eye. But this means that we can really take care of much smaller bladder tumors, and people that have multifocal tumors, meaning tumors in multiple parts of the bladder, we can really kind of see them and manage them, and then help to prevent them from coming back and progressing.
That's another amazing, it's like I was saying, technology really is progressing so fast for so many different areas. And then lastly, let's talk about, we always talk about, what people can do to prevent certain types of things. And of course, you talked a little bit about testing, getting the testing. What are some of the things people could do?
So smoking is a big thing. So a lot of urologic cancers are related to smoking, or worsen with smoking, specifically bladder cancer, kidney cancers. So if you can cut back on smoking, or quit smoking, that would really help to prevent it from happening, or prevent it from progressing. If you already are diagnosed with cancer, to try and quit smoking can really help. And then really screening is very important. So,
Okay.
you know, PSA screening, getting rectal exam, like a rectal exam to feel your prostate, getting, if you see blood in your urine, seeing your urologist or your primary doctor, having, you know, urine tests to check and see if there's microscopic blood in the urine.
Okay.
All of those things can really help to diagnose early.
Exactly. All right. Well, thank you so much. It was very nice to meet you.
Thank you.
And welcome to Orange County.
Thank you so much. Thank you.
All right. If you want more information about anything we have discussed related to these types of cancers, you can go to memorialcare.org/SB Cancer. We'll be right back.